Hi, I'm Dr. Jocelyn Lebow, a clinical psychologist with Mayo Clinic, here with you to talk about binge eating disorder. Most everyone overeats on occasion, like having a second or third helping at a holiday meal. But for some people, regular excessive eating can cross the line to binge eating. Binge eating disorder is when a person frequently consumes unusually large amounts of food and feels unable to stop. This disorder is characterized by recurrent binge eating at least once a week for at least 3 months. Binges can include eating extremely fast, eating to the point of nausea, and eating when not hungry. They also often occur in secret and can be followed by strong feelings of guilt or shame. People who binge eat also experience a loss of control. People will describe this feeling as if they can't stop eating even if they want to. When diagnosing a binge episode, there's strong evidence that the feeling of losing control is more important than the amount of food consumed. Binge eating disorder is a dangerous cycle. Individuals restrict their diet, leading to increased psychological and physiological pressures to eat. Ultimately, this leads to a binge episode, which is often followed by shame and distress. This in turn leads to increased pressure to restrict, again restarting the cycle. If an individual goes through this cycle of restriction and binge eating enough times, it can impact metabolism, causing weight gain, which further perpetuates the cycle. The exact cause of binge eating disorder is unknown, but many factors play a role in the development of eating disorders, including genetics, biology, psychological factors, and long-term dieting. According to national surveys, the median age of onset for binge eating is 21 years old. There are some risk factors that increase a person's chance of developing binge eating disorder. These include dieting or losing weight for any reason, diabetes, medical conditions, or medications that interfere with appetite, athletes who do not increase their calories during their sports season, a history of yo-yo dieting, being bullied or shamed for weight, and traumatic experiences. Binge eating disorder is associated with high rates of obesity, depression, anxiety, feelings of hopelessness, and increased self-harm. People with binge eating disorder also often report lower quality of life. In contrast to common thought, binge eating disorder can affect people of all body types. You do not have to be overweight to have binge eating disorder. The good news is that binge eating disorder is very treatable. Though it seems counterintuitive, the first step to addressing binge eating behaviors is to normalize eating, meaning eliminating all dieting and restrictive behavior through evidence-based therapy. Individual therapies, including enhanced cognitive behavioral therapy and integrative cognitive affective therapy, or a combination of group and individual therapy, such as dialectical behavioral therapy. Some individuals may need to go to a treatment center to break the cycle of binge eating. If you have a friend or loved one you're worried about, urge them to talk to a doctor. They are not alone, and treatment does help. Learn more about binge eating disorder at mayoclinic.org. We wish you well.